Welcome back. November is National Caregiver Month, and with New York State's senior population growing and 8 times faster than the state's total population over the last decade, VNSNY Partners in Care is providing home care services matching the needs of their clients from bathing and grooming all the way up to skilled nursing. Now, joining us to share more details is VNSNY's Partners in Care Director of Quality, Debra O'Hehir, the Assistant Director of Quality and Education. We've got Kennya DiLegge, and we thank you both for sharing with us here on the show.
Good morning.
Debbie, good morning. Good morning. And Debbie, I'll begin with you. As we talk about National Caregivers Month, I mean, we pretty much know, we hear the term caregiver, but can you give us some legs on what exactly is a caregiver for somebody who doesn't know?
So a caregiver at Partners in Care is a VNSNY Partners in Care would be a home health aide that comes in and, as you said, assist with grooming, assistance to appointments, as well as we offer nurses to come in and provide an array of services as well. But there's a professional caregiver, and then there's the non-professional caregiver, which is family members, loved ones who care for individuals in the important part of the community and, keeping individuals safe and healthy at home.
And Kennya, for you, a little bit about caregivers, because I know during this time of year, we're highlighting caregivers, but one of the things that I know that you guys really specialize in is dealing with that senior population. And one of the things that happens with seniors is really a lot of times they tend to fall. So talk to us about what you do in terms of preventing falls and what somebody else can do in terms of helping a senior to prevent falls.
So falls prevention is a vital part in keeping our loved ones safe in the home. So what safe means when you're in your 40s as opposed to when you're in your 60s and 70s and 80s varies tremendously. So each Partners in Care client receives a clinical assessment by a trained nurse who reviews the physical, the mental health of a patient, of our client population. So, and that includes vision and hearing and anything that could impact mobility, balance, and stability. So before a home health aide is assigned, there is this comprehensive assessment, which includes a review of the home environment. And there are many recommendations to help our elderly population to stay home, to stay safely at home. To name a few, there's grab bars in the bathrooms, in tub or shower and toilet. And remember not to use towel racks because it's very unsafe and unsteady to use towel racks. So properly installed grab bars, a chair for the shower, lights in the stairway or in any darker corners. You need very well lighting in the home. And we often recommend removing throw rugs or anything that they can trip or slip or fall on any particular loose area rugs. And our home health aides, they assist with keeping clutter, keeping the environment clean, because clutter can lead to a fall event. And making sure the shoes that the individual is wearing in the home is not slippery. And there are many tips around falls prevention, but these are a couple of tiny different aspects of the home environment that could impact and potentially prevent fall events.
Yeah, thank you. And Debbie, I want to take a moment just to look at some of the things that caregivers have to deal with when it comes to seniors. And sometimes you've got to deal with seniors who are dealing with dementia, and not just dementia, but also Alzheimer's as well. And for family members, it's hard to really be able to determine whether or not their family member is really in that stage or not. But talk to us a little bit about the work that you do and really how we can detect whether or not something is wrong there.
So, again, what you just said. So I know for me, watching family members struggle with memory loss and cognitive lapses, as an adult child, it can be very difficult. We frequently refer to these as senior moments, but they're really a part of normal aging, and that some of them require medical attention. Many people think that dementia is Alzheimer's, and there's actually a difference. In dementia is not a disease at all. It's more of a used term to describe symptoms that interfere with the brain functions, especially in social and in intellectual abilities. So dementia, you might see a change in memory, a change in language, and problem solvings, as well as just general confusion. For a family member or a loved one to recognize, loved ones might not recognize them. And if a loved one shows signs of cognitive problems, that you worry and speak to your physician. The doctor probably will run a variety of tests and assessments to determine the cognitive ability. It's so important to get help, because it can be very frustrating and you're going to have a lot of concerns and emotions. So it's really important for the loved one to get help as well, because even if the dementia isn't treatable, as I said, it can deal with frustrations and concerns, and you want to address them so you can be a better caregiver to your loved one.
Yeah. No, I didn't mean to cut you, but I'll say since you stopped, got about 2 minutes left, but I want to be able to talk a little bit about this, because when we talk about where we are today, a lot of seniors are really dealing with isolation and really socialization challenges, because just being home and not being able to connect. As a caregiver, how do you go about helping them in this area of connectivity? I'll hear from you both.
We're almost 2 years into the pandemic, and it's been very difficult for everyone. Homebound or older people who don't get out as much as they used to can be at risk for depression if they're alone day in and day out. And everyone's needs are very different. Isolation, for example, which is the amount of contact with friends and family, doesn't necessarily lead to loneliness, which is how a person actually feels. You can live with someone or have people around you and still feel lonely. And other people are perfectly content with spending time alone and being home alone. But the partners in care, caregivers, take many different things into consideration. And it's something that family members should ask yourselves. How is your family member overall health? Is the limited mobility a common reason for isolation? The inability to drive a car. There are particular things that will lead to loneliness and depression. And does the loved ones, do they visit? Do they get phone calls? Do they FaceTime with grandchildren? And there are particular signs and symptoms that our caregivers are trained to observe and report that could mean depression and loneliness.
Well, I definitely want to thank you guys for joining us, ladies. I should say not guys, I can be more specific, but thank you, ladies, for joining us and really sharing a little bit about the work that's being done during National Caregivers Month, because it's so important. And I think the work that you do is tremendous. And Partners in Care, being a partner with VNSNY for really taking care of our seniors and that vulnerable population really sometimes goes under noticed and under celebrated. But we want to thank you for being with us and sharing some much needed tips as well.
Thank you so much.
Thank you for having us.
You're welcome. And I want to let you know now, listen, if you want more information, always visit the website, vnsny.org. Also follow them on their Instagram and Facebook page at VNSNY. We do have more show coming up. Don't go anywhere, because Open continues coming up right after this.